A concussion is a mild traumatic brain injury that causes a temporary loss of normal brain function. Most concussions are caused by a direct blow to the head, but they can also be caused by any forceful impact that violently moves the brain. There have been over 3 million concussions reported over the past 25 years for soccer players aged 7 to 17, accounting for a little over 7% of all soccer injuries. They are usually caused by being struck by the ball, colliding with other players, or from falling. Some of the most common signs and symptoms that can be present with a concussion include headache, blurry vision, dizziness, balance issues, sensitivity to light and noise, nausea, difficulty concentrating, fatigue, trouble sleeping, impaired memory, mood swings. If your athlete displays any of these symptoms, they must stop all physical activity and cannot return to sports the same day. Second impact syndrome is a serious condition in which a second concussion occurs before the brain has properly healed from the initial concussion. This causes rapid brain swelling, loss of consciousness, and increased risk of death. The typical treatment for concussions includes cognitive and physical rest until symptoms reside, and then gradual reintroduction to physical activity in sports. Although recovery time may differ from case to case, your athlete will get better and normal brain function will be restored. Post-concussion syndrome is when symptoms are still present beyond the normal recovery time, lasting for weeks, months, or even years. Athletes with post-concussion syndrome tend to require additional rest from physical activity and rehab with the help of the appropriate healthcare professionals in order to return to their prior level of function. If you believe your athlete has a concussion, there is usually no need to rush them to a hospital since they should recover relatively quickly with sufficient rest and gradual reintroduction to their normal activities. However, if your athlete displays with any of the following signs or symptoms, they should be taken to the ER for appropriate imaging and a neurological examination. A primary care physician should also be seen in order to clear the athlete to return to school and sports. Physical therapy can play several roles in the management of concussions in athletes. A physical therapist can conduct baseline concussion testing prior to the season, perform thorough examinations and follow-up testing on athletes suspected of having a concussion, give exercises to improve balance, coordination, and vision deficits, and help refer you to appropriate healthcare professionals for impairments outside or scope of practice. A physical therapist can also bring your athlete through the 6-step return to play protocol while monitoring their heart rate and blood pressure. The protocol starts once the athlete no longer has symptoms and then gradually introduces light aerobic exercise, sport-specific exercise, non-contact training drills, full contact practice until finally allowing the athlete to return to play. In summary, concussions are common in youth soccer, but by being able to recognize the signs and symptoms and act appropriately with help from healthcare professionals like physical therapists, a full recovery can be made within a week or two. If you have any questions or would like to set up an appointment, please feel free to call us at 732-807-5059. Thank you for watching and have a great day.